discovered nutritional solutions for peripheral neuropathy. Heal your nerves naturally. Are you suffering from debilitating effects of neuropathy? These are the most common symptoms of someone who has neuropathy. We're talking about numbness, tingling, burning pain, stabbing pain, walking with a shuffle. Even affects your hands. Your grip strengths get weaker. Inability to feel hot or cold. Now this is interesting. Some people, their feet are burning. They can't have their covers touch them. Other times your feet are freezing. So you can have either one of those. Crawling sensation of the skin, freezing in your hands and feet, and now you're having some medication side effects. So if you're having these symptoms, this video is for you. This video is going to guide you through essential nutrition that can help you heal yourself. So this video is all about the proper nutrition to stop the degeneration, start the regeneration, decrease pain, decrease burning. So we're going to cover all the different things necessary for you to eat your way to better health. We're going to provide a clear and concise information how to quickly incorporate nutritional changes in your diet. By following these guidelines, you can begin to experience safe and effective relief from peripheral neuropathy symptoms. I'm Dr. Gregory Kramer. I'm a Livonia-based chiropractor. I have over 30 years experience treating chronic health problems. Chronic health problems would be things like peripheral neuropathy, chronic spinal disc bulges, particularly L4, L5 disc bulge or L4, L5 disc herniations, chronic knee problems, chronic feet problems. I have seen over a couple 100,000 office visits over the last 30 years. And I love helping people just like you. And I also have had disc problems and neuropathy. So what I learned for myself, how do I help myself? I share that with you. All of my methods are non-drug, non-surgical. I focus on 3 basic aspects of helping your body heal itself. We look at you structurally, neurologically, and metabolically. Structurally is looking at the alignment of the spine. Do you have a pinched nerve in your spine affecting the nerves going to your feet? So this is a simple little picture. The brain controls your feet. Those messages have to go all the way down to your feet. So again, the brain has to talk to your feet. Is there some type of structural distortion that's impinging on a nerve affecting your feet? The second thing we look at is neurologically. So when you have chronic inflammation, chronic irritation, chronic impingement, the nerves stop communicating from the brain to the feet. So we want to re-educate those nerves. We do it both in the office, and we have types of rehab equipment that you can use at home to start re-educating those nerves. And thirdly, we look at you metabolically. That's typically with diet and nutrition. And that's primarily what this video is today. So before we go to the end, what I'd like you to do is subscribe, okay? Just like and subscribe our page. We have a video usually every week. So if you learn how to live stronger longer, eliminate pain, avoid surgery, go back to doing all the things you want to do, just like and subscribe. Influence of nutrition on nerve health and nerve function. Proper nutrition plays a vital role in supporting the health and function of our nerves. The nutrients we consume throughout our diet provide the building blocks necessary for nerve cell structure, function, and repair. Here's how nutrition influences nerve health and nerve function. So let's start with the essential nutrients, okay? Let's talk about the B vitamins. We're talking B1 thiamine, B6 pyridoxine, B12 cobalamin, and folate. These are essential for nerve health. They contribute to nerve cell formation, myelin production, and neurotransmitter synthesis. What also need is omega-3 fatty acids. So basically, what do we need to eat? Avoid junk food. It's real simple, okay? Fish, chicken, beef, liver, eggs, lots of fruits and vegetables, green leafy vegetables, nuts and seeds. Now the challenging part is if you're a vegan or vegetarian, where do you get your B12 from? That's the hard part. So B12 is from fortified foods. You can get it in tempeh. You can get it in nutritional yeast. So that's a little bit challenging. Some fermented beverages, some algae, that's a tough one. But for people that are eating animal products, you're going to get plenty of these nutrients if you eat lots of vegetables, lots of fruit, nuts and seeds, meat, fish, chicken, liver. Those are all great sources of the essential nutrients you need for your body, and particularly nerve health. Now, what is myelin? Myelin is a protective sheath that surrounds the nerve fibers. It's designed to enable efficient nerve signal transmission. Certain nutrients such as vitamin B12 again, folate, our essential fatty acids are crucial for myelin synthesis and the maintenance. Now, nerves have the ability to regenerate, all right? Now, sometimes it doesn't matter if you're getting better because your nerves are regenerating or because they're re-educating, okay? So don't get too hung up on that. Our job is to help your body heal. We want to eliminate pain. We want to eliminate that burning and numbness. We want to help your body heal itself. So again, we're trying to help the body heal itself. Sometimes it's through the process of nerve regeneration. Sometimes it's through the process of nerve re-educating. Now, do you really care if your feet feel better and you can walk 5 miles, whether it's nerve re-educating or nerve regeneration? It doesn't matter. So also, we're talking about nerve cell signaling. This is why we need things like calcium, sodium, potassium. So again, we want to have foods. We want to get fruits and vegetables, leafy greens, nuts and seeds, so we have essential nutrients in our body. Also, when we eat those greens, those vegetables, it has an anti-inflammatory effect. So alcohol, you got to get rid of the alcohol. You got to get rid of the junk food. You should not be eating at a gas station. Balancing your blood sugar is another factor, plays a huge role and plays probably the most common role in neuropathy. So again, we want to eliminate the alcohol. We want to eliminate the pop. We want to eliminate anything that has sugar in it. Get your sugar from fruits and vegetables. Now, in this day and age with continuous glucose monitoring or CGM, you can see how your blood sugar reacts to food. Sometimes food combination plays a role. So eating a little protein, a little healthy fat, along with some fruit can prevent your sugar from spiking. So again, you can personalize your diet with a CGM. That's the fantastic thing. Now there's some micronutrients that also help with neuropathy. We're talking about very specific nutrients such as alpha-lipoic acid, citrulline, beetroot. These all have shown in promise in helping people with neuropathy symptoms and promoting nerve regeneration. These nutrients are obtained through dietary sources of supplements such as Blueprint's VasoPro Plus. I love that supplement. I take it myself twice a day. And we'll talk about these micronutrients specifically for neuropathy, probably on the next video or two. By emphasizing a balanced diet rich in essential nutrients, you as an individual, that's you out there, can support nerve health, protect against nerve damage, potentially slow the progression of neuropathy, and potentially start the regeneration. So you have a lot of control what you can do from a metabolic effect. You now have a clear understanding of how nutrition can play a vital role in healing peripheral neuropathy and actually preventing neuropathy. Remember, focus on the essential nutrients. Supplements for myelin production, nerve regeneration, and proper nerve cell signaling. Incorporate an anti-inflammatory diet. Manage your blood sugar levels. Look, you can prick yourself to know what your sugar is. You can use a CGM. You want to make sure that you have normal blood sugar. Ensure you're getting the right micronutrients. Take proactive steps today to support your nerve health and improve your quality of life. Now I want to hear from you. What have you done? Have you changed your diet? Have you used some of these essential supplements? Have you gone to a vegan diet, a carnivore diet, a low carbohydrate diet? What have you done? I want to hear from you. And I would like to create a community of people and what we have done to create success. I myself have had neuropathy since about December around 2023. So I'll share with you what I've done for myself and what I've done with some of my patients. So the bottom line is if we all share experience, we can kind of help each other. So if you are looking for help, all you got to do is ask. We'll find you a doctor in your area that utilizes some of the protocols that I do. All right? If you found value in this video, please do me a favor. Like and share this so more people can learn about all the causes of neuropathy, what you can do to help yourself. Remember to subscribe to my channel if you want to learn more tips on how to eliminate pain, avoid surgery, stabilize your body so you can live stronger, longer, doing the things you want to do. Now, the next video you should watch, you will learn about my 3-step approach for treating neuropathy. Go watch this video here.